Welcome to Evidence Mastery with Dr. Masood Doozy. I am going to help you understand what a stroke is and how it is managed. Please note that this explainer is for education only and will not replace your doctor's advice. So let's talk about stroke. It's a pretty significant medical event. Here in the United States, it's actually the fifth leading cause of death, and it's the #1 reason adults have long-term neurologic disability. Really understanding what's going on during a stroke is the absolute first step toward managing its profound impact. All right, here's our game plan for this explainer. We're going to build our understanding across 5 key areas. We'll start with the basics. What exactly is a stroke? Then we'll dive into its causes and the risk factors. From there, we'll learn how to spot the signs and understand the diagnosis, move into the really time-critical treatments, and wrap up with the journey of recovery and, importantly, prevention. So, what is a stroke at its very core? Well, the evidence defines it as a sudden focal neurologic deficit that's caused by an interruption of blood flow to the brain. This lack of oxygen and glucose is exactly what leads to injury and ultimately the death of brain cells. Strokes are generally broken down into 2 main types, and as you can see here, the evidence shows that the vast majority, about 80%, are ischemic. That means they're caused by a blockage, like a clot. The other 20% are hemorrhagic, which is when a blood vessel actually bursts, causing bleeding inside the brain. We also have to talk about something called a transient ischemic attack, or TIA. Think of this as a temporary stroke, where the symptoms often go away in less than an hour and there's no permanent damage. But, and this is a big but, the evidence is crystal clear. A TIA is a massive warning sign. It signals up to a 10% risk of having a major stroke within the next 48 hours. It's a critical wake-up call. Okay, so to really get why a stroke happens, we need to look at 2 things: the brain's incredibly complex network of blood vessels and the risk factors that can put that whole system in jeopardy. The brain's blood supply is like a massive highway system with 2 main routes. You've got the anterior circulation, which comes from the internal carotid arteries and feeds most of the main parts of the brain. Then you have the posterior circulation, which supplies the brainstem and cerebellum. And connecting them is something called the circle of Willis. It's like a crucial roundabout that can provide a detour or collateral flow if one of the main highways gets blocked. A stroke happens when traffic on one of these critical pathways gets stopped. Now for the good news. The evidence shows that many of the biggest risk factors for stroke are things we can actually do something about. Hypertension, or high blood pressure, is consistently pointed to as the single most important one, public enemy #1 for stroke. But other major players include smoking, high cholesterol, diabetes, and an irregular heartbeat known as atrial fibrillation. And then, of course, there are some risk factors you just can't change. These include getting older, having a family history of stroke, or having had a stroke before. Having these factors just makes it all the more important to be really aggressive about managing the ones you can control. We're now at a really critical part of our discussion: how to actually recognize the signs of a stroke and what happens in the emergency room to diagnose it quickly. So how do you spot one? The absolute key is the suddenness of it all. The symptoms don't creep in, they hit you out of nowhere. Let's look at the most common ways a stroke shows up. Stroke symptoms are all about that sudden onset. The classic signs are a sudden numbness or weakness, usually on one side of the body, affecting the face, arm, or leg. Sudden confusion or trouble speaking, we call that aphasia, is another huge red flag. Other telltale signs are sudden vision problems, dizziness, losing your balance, or a really severe headache that comes out of the blue. And what's really fascinating is how the specific symptoms can give doctors clues about exactly where the stroke is happening. For instance, if the middle cerebral artery is blocked, you'll often see weakness on the opposite side of the body, mainly in the face and arm, along with that difficulty speaking. But a blockage in the back and the posterior circulation might cause things like dizziness or double vision instead. The second a stroke is suspected, the emergency evaluation kicks into high gear. The very first step is a quick blood sugar check, because really low blood sugar can sometimes look a lot like a stroke. But the absolute cornerstone of the workup is an immediate head CT scan without contrast. This is often followed by more advanced imaging like a CTA to look for blockages in the large blood vessels. And this slide right here shows you exactly why that initial CT scan is so vital. If it's a hemorrhagic stroke, a bleed, the blood shows up right away as this bright white area. But with an ischemic stroke, the kind caused by a clot, the CT might look totally normal for the first few hours. Figuring out which one it is, a bleed or a block, is the single most important question to answer because it dictates everything that happens next. This brings us to treating the stroke in the moment. Once a bleed has been ruled out, the main goal for an ischemic stroke is what we call reperfusion, getting that blood flow back to the brain as fast and as safely as possible. There's no phrase that captures the urgency here better than time is brain. The evidence suggests that for every single minute a major stroke goes untreated, the brain can lose up to 1.9 million neurons. Let that sink in. Nearly 2 million brain cells gone forever. This is exactly why getting treatment early is directly linked to better outcomes. So, there are two main ways we restore that blood flow. The first is a powerful clot-busting drug given through an IV. Think of it like a chemical drain cleaner for the blood vessel. It's incredibly effective, but there's a very tight time window, usually just 3 to 4.5 hours from when symptoms started. The second option is a mechanical thrombectomy. This is where a specialist actually threads a tiny catheter up into the brain and physically pulls the clot out. It's an amazing procedure, and it has a much longer time window, up to 24 hours for some patients. Now, on top of trying to open up that blocked artery, really careful supportive care is crucial to protect the brain from any more damage. This means things like making sure the airway is open, managing blood pressure very carefully, keeping blood sugar in a normal range, and treating any fever, because a high temperature can actually make the brain injury worse. Okay, for our final section, let's focus on what comes after the immediate crisis, the journey of recovery, and the absolutely critical job of preventing another stroke. Rehabilitation is where the really hard work of recovery starts, and it's a team sport. You have physical therapists working on strength and walking, occupational therapists helping with everyday tasks, and speech therapists tackling communication and swallowing. And just as important is screening for and treating post-stroke depression, because it can have a huge impact on a person's ability to participate in their own recovery. The number one goal long-term is preventing another stroke. The evidence points to a strategy with a lot of different parts. Things like antiplatelet or anticoagulant medicines, a high-intensity statin to lower cholesterol, and of course, aggressive management of all those modifiable risk factors we talked about earlier. And if you need any extra motivation for why prevention is so important, just look at this number. The data suggests that about a quarter of patients will have another stroke within 5 years. That statistic is a really powerful reminder of why diligent, long-term management is just not optional. So, what's the most important conversation you can have about prevention? Well, the evidence suggests it's the one where you and your doctor come up with a clear, personalized plan to get a handle on your specific modifiable risk factors, especially, number one, your blood pressure. I hope you enjoyed this video. Please feel free to share your experience or questions in the comments. Please note that I won't answer personal questions. If you found this video helpful, don't forget to subscribe to my channel.